So our next shot is going to be the 08. On our model, it will be 108. So we're going to put our plate in. We're back in landscape mode. So you're going to place this underneath that tooth, and your placement of the plate, you want the tip of this crown to be right in the center of the plate when you measure it from the front of the plate to the back of the plate. So you want that crown tip to sit right in the center and right on the edge of the plate to give all of your plate to your roots, because this tooth in many of your patients will be quite large, many of your dog patients, that is. And you'll be up against the hard palate, and so you'll use your endotracheal tube to kind of prop that plate up into place up against that hard palate. If you need to, of course, you can always use gauze. Now remember, this tooth has 3 roots. So we have 2 roots in the front, and the back root is a single root. So when we are shooting this may take multiple shots depending on the condition of the patient. So if you have a patient with a tooth root abscess, you will need to be able, your doctors are going to need to be able to see if there's periapical lysis or an abscess on 1 root, 2 roots, or all 3 roots. So you may have to work a couple different positions with this one. Right now I'm just going to show you how to do a straight on shot. So I have my plate in place, and I am going to take my tube head and I'm going to come straight lateral to the head. So I want to make sure that I'm kind of making the letter T with my head and my tube head. So I'm going to set my tube at 45 degrees. I'm going to come straight lateral. So this would be the top of the T, and this would be kind of the stalk of the T. So I want to make sure that that is nice and straight. Put the cone as close as possible to the patient without touching, and shoot your image.